again. Okay. Hi, everyone who's here live and those who are watching the replay. So I'm going to get started just because I know that time is a precious resource for everyone. So this is the Welcome to Rheumatoid Arthritis webinar on March 28th, 2022. So I'm going to start sharing my screen because I have a little presentation. Those of you, I'm curious, has anyone else here used the software Canva? Or is it software? It's a website. It's very dangerous. It's very fun. They make it too fun to make. It's like a more exciting version of PowerPoint, basically, or Photoshop. It's an easier version of Photoshop and PowerPoint together. Anyway, so I am Cheryl. Some of you know me from social media, but I'm going to introduce myself in a second. But you are in the right place if you have a rheumatic disease, which I know is like a very vague term, but rheumatoid arthritis, psoriatic or ankylosing spondylitis, or other spondyloarthropathies and spondyloarthritis forms, and maybe are confused or overwhelmed about how to manage the symptoms, how to cope with the stress and uncertainties, and maybe feel a little bit like you've been left on your own, trying to figure out how to navigate this new normal. And the other day, someone brought the best analogy up to me. They said, I feel like I've been dropped into like a 400 level course and I haven't even taken the 100 level. I was like, oh, that is the best analogy. Sorry, I'm trying to adjust okay, I'm going to stop focusing on my lighting. It doesn't matter. No one cares. Okay. So that's my self-talk. Yeah. And then, oh yes. And yes, thank you for asking. Please ask any questions in the chat. I do monitor the chat while I'm talking. I know sometimes when people are speaking, they're like, don't write in the chat. I don't want to look at that. But yeah, yes, I will give you the PowerPoint. I should have gotten that to you beforehand. That's a good idea for next time. So I'm going to give you a little bit of an introduction in like rheumatoid arthritis 101. I'm going to do that really quickly just because it is information you can kind of find online, but I'm going to try to give my own little spin on it. And then some words of encouragement and tips that I think are really helpful, like these 4 things here, and then direct you to some more resources. So so what, I think it's a little obvious, but one of these adult learning principles is like, you need to explain what's the point. And so I think we all are united in wanting to improve our quality of life and well-being and relationships so we can actually try to live a good life and a life that we love with rheumatoid arthritis. And I'm very intentional about the language I use, maybe to an annoying degree, but I think there's a lot of people, and Megan and I chatted about this a little earlier today, but sometimes there's a lot of messaging in the autoimmune space where like you have to heal or cure your illness. And, that makes that can potentially backfire for numerous reasons, but point being, and you'll kind of see throughout here why I have the philosophy I do. But I really try to say, okay, well, what if the rheumatoid arthritis is with us? What if it's not going away? It's a chronic condition. How can we still live a good life with it? I find that to be a more helpful question for me. So hello, Dawn, welcome. Let me know in the chat where you're calling in from if you have time or if you're like able to type in. I know some people are multitasking. This is my cat, Wally. He just wants to say hi. So, just a quick introduction. I think I only really talked about this on social media. So I think maybe most of you know, oh no, you don't. So some of you are maybe from Facebook. I have had rheumatoid arthritis for 19 years. And 6 years after my diagnosis, I started studying to get my master's in occupational therapy, which if you don't know, I like to say the shorthand, it's like a blend of a counselor and a physical therapist. Like we are often confused with physical therapy, but we actually have mental health training, which is physical therapists don't, as part of their like board certification. They do like learn things like the biopsychosocial model, and like they're not, and so we all work together on a multidisciplinary team and they're amazing, but that's how I distinguish like OT from PT. And so it really is focused on practical tools. How can we adapt and adjust to your disability, illness, or injury, and remediate it if possible, and I also have, I need to change that. He just turned 8. My son just turned 8. So I'm a mom, and I founded Arthritis Life because I saw this huge deficit in the patient education and support resources that were out there. So, this fits into some of my other programs of what I'm going to talk about today. I have a self-paced course called RA Roadmap, and then a Room to Thrive really hybrid of, it's basically an educational support group. And it's weekly meetings where I give little lectures on the topic of the week and on these different topics here, like physical, mental, social tools. And then we have like a more of a traditional support group session. So that's, I'm going to talk a little bit more at the end, but just so you know, this fits into that. So why is it hard to adjust to your new normal with rheumatoid arthritis? Just a few reasons. Again, hopefully this sounds familiar to you, but a lot of information overload, like the person mentioned, it's like you're at a 400 level course and you haven't even taken the 100 level. You know, there's lots of unknowns. How long is it going to take to respond to the medicine? Am I going to respond to the first one, or is it going to take another few, you know, trial and errors? You know, there's the social effects, people maybe not getting it, saying, oh, it's just arthritis. And, you know, job, financial worries, confusing medical jargon, a learning curve of just learning how to be a patient, especially like I had been really healthy my whole life until this. So like, I just didn't even know the first thing. I didn't know doctor's appointments had an end time. I knew they had a start time, but I didn't know they had an end time. And then, you know, I want to recognize that many people with rheumatoid arthritis and similar conditions have some degree of medical trauma, whether that's from, you know, I was falsely, you know, I was misdiagnosed and accused of being a hypochondriac and accused of hiding an eating disorder and all sorts of things. And that was really, really challenging, you know, so a lot of us kind of come into this diagnosis from a status of like, whoa, this wasn't easy to get here, you know? So, thank you for being here. So even though we are overwhelmed, I'm still going to give you more information, which is kind of the hard thing. It's like a paradox. You need information to be less overwhelmed, but it can be overwhelming. But okay, so I mentioned before, you know, a lot of challenges, uncertainties, and overwhelm, learning how to be a patient. But when we think about rheumatoid arthritis, psoriatic, ankylosing spondylitis, like what have I not even mentioned? Like what do most people think when they hear those terms? What do they think would be the hard thing about it? Anyone think like even just the word, what does the word arthritis mean? Sorry, I'm such like I'm like a closeted teacher. Like I want to be a teacher. It means joint pain. So I didn't even mention the pain, the pain and fatigue. I think I saw Megan like mouthing it. Yeah. So you actually have to deal with physical symptoms on top of all of that. There's different, and pain isn't just one thing. Pain's not like hunger where you're kind of like, you're hungry, you're a little bit hungry, you're not hungry. It's like, there's all kinds of pain. I could be at a 0 on sharp stabbing pain, but at an 8 on stiffness and dull achy pain. You know, there's obviously different levels of fatigue as well, which I didn't even know was related to rheumatoid arthritis till I had it for a while. So, and there's other extra-articular symptoms and medication side effects. So again, I'm not trying to belabor the difficulties, but I'm actually trying to validate the difficulties. So if you're having a challenging time, it's a lot to adjust to. And these are just some quotes when I posted on social media, like what, you know, what's hard for you? What's stressful for you about having this condition? You know, people say very few people understand, or they think they understand and then they actually don't, which is almost worse, right? Because if someone doesn't understand, but they're open to learning, then you could be like, okay, oh, actually it's this. But if they think, they're like, oh, I know what that is. That's not a big deal. That's just like your knee hurts. And you're like, actually, no, you have to then have them confront the cognitive dissonance that like they're wrong, you know? And, you know, struggling to pay attention to your own needs while also fulfilling your roles as like a parent, partner, community member. And your identity, your sense of self can change, you know, doesn't necessarily change, but for many it does. So just again, validating that you're, you know, it's hard to adjust to this for many people. You are not alone. So I'm going to give you a quick crash course. Again, this part's going to be fast, but it's all recorded so you can review it later. But what does the word arthritis? It means joint inflammation. So arthro is the space between the bones, as this is a gross generalization, but itis does mean inflammation, just inflammation. And arthro kind of has to do with joints. So you have bones, and then you have a joint capsule, and you have space in between them that is getting inflamed. And so with rheumatoid arthritis I like to imagine it as these like kind of excited but misguided immune cells that are like, I know what to do. I'm going to attack these viruses. It basically thinks that the synovial lining and synovial fluid in your joint is bad. It thinks it's not part of you. So that's the whole root of autoimmune, is when your own immune system turns against your healthy cells. So that's why it's an autoimmune disease, unlike osteoarthritis, which we'll just cover quickly later. But this is just the example of rheumatoid arthritis. So initially, you don't have any bone on bone, arthritis, but over time, the actual friction of too much fluid and inflammation being in your joint can cause erosion and other secondary effects. So there are actually over 100 different kinds of arthritis or diseases that fall under the umbrella of the concept arthritis. So the most common one is osteoarthritis, which confusingly, even though arthritis means joint inflammation, osteoarthritis typically isn't considered like an inflammatory form of arthritis. Often when people say inflammatory or autoimmune arthritis, they mean the types that are autoimmune. So again, just a quick introduction, already it's confusing, right? There's very little blacks and whites. It's a very gray area. So to say there's very few black and whites, like it always is this, or it never is that. The non-joint symptoms extra-articular are things like lack of energy or fatigue, which doesn't get better with sleep. So that's kind of the key difference between fatigue and sleepiness, although they can overlap. Like I definitely know for myself personally, like lack of sleep can be a trigger for fatigue, but it just doesn't necessarily get better if I sleep adequately, the fatigue. Fever, sweating. The ones I had that made people think I had an eating disorder was like poor appetite and weight loss. Then if you have severe muscle loss, like I lost like 25 pounds of muscle on a small frame, it's called rheumatoid cachexia, which isn't as common, but it's more associated with like severe rheumatoid arthritis, and dry eyes, heart and lung problems, and not surprisingly can lead to depression and or anxiety really from just dealing with all this. So, a few terms you might hear after you're diagnosed are things like flare up and remission. So when people say flare up, it's just a period of time when you feel worse than your baseline, which it's hard to know what your baseline is supposed to be when you're newly diagnosed, but feel worse than your current baseline. So maybe my joints are flaring today. It could be a period of like a couple of days. It could be a period of weeks and months. And then remission is when you're a period where you have no or little symptoms and your disease is not active in your blood work. And then rheumatoid arthritis really, and this is the thing I wish I had known when I was diagnosed, is that it's normal for it to fluctuate. Like that's just the nature of the disease, that it's not like you're aiming to get to a static point that always is that way. It's typically up and down, because I kind of thought, oh, I just need to figure it out and then it will always be better. So it is technically a progressive disease, and that means it will get worse over time unless it stops. So this is like good news, bad news, good news, bad news. Okay, so that's the reality, is that it's a progressive disease. But the good news is that we're living through the best era of history in terms of the medications that can slow down the progression. But the not good news is that they don't always work for everyone and they can have side effects. But the good news is that the prognosis has never been better, and there are still more good medicines coming down the pipeline, and there is some emerging evidence for some of the lifestyle and interventions like nutrition, exercise, things you can do to things that are in your control to help slow down the disease. So there are some rheumatologists that are even saying they don't even really consider rheumatoid arthritis as progressive a disease as they used to, but like I still think it's important to know that it is like some diseases like kind of are a certain way and then they don't necessarily get better or worse, but it is the nature of it that it will get worse if it's not slowed down. So there's lots of medications. The 4 types are either the disease modifying anti-rheumatic drugs, the biologic modifiers, which confusingly are actually like a subtype of DMARDs. People call them DMARDs. So like DMARDs are like methotrexate, Plaquenil, and sulfasalazine. Then biologic DMARDs, often shortened to just biologics, are things like Enbrel, Humira, Remicade, Orencia, Xeljanz. And then these 2 are the ones that actually slow down the disease. These 2 address symptoms, but don't slow down the disease. So these are not enough to slow it down. So, but they can provide symptom relief and reduce a little bit of inflammation. So we have non-steroidal anti-inflammatories, NSAIDs, it's like Aleve, and steroids or corticosteroids like prednisone. So these are usually used short term because they have a lot of bad side effects if you're on them for like months or years. But that said, it's always a cost benefit analysis with your medical team. So the last thing on the RA 101 is that, it's really important, especially if you're on a lot of social media groups, to know that like there were no good methods to prevent or stop joint damage from rheumatoid arthritis until the kind of mid to late 1990s. So, and this is where it kind of is it progressive or not? Current therapy for RA is such that progression from symptom onset to significant disability is now no longer inevitable, and RA patients can anticipate comfortable and productive lives on medical therapy. That's from the Rheumatology Journal. But again, there seems to be a certain subset of people that their bodies are just really dead set on attacking their joints, and they don't respond as well to the medications. And there's a lot of researchers that are looking into, if you've heard of personalized medicine, or what's the other word for it? It's medicine where they can do a better job giving you the right medicine at the right time, where instead of kind of having this throwing darts at a dartboard feeling of like, well, we'll kind of try this and see if it works. So kind of adjusting it to exactly your genes and your other factors. So deep breath. So please feel free to ask me questions in the chat as we go along. And I will be leaving time at the end for questions, just so you know. So the 4 things I think are really important when you're newly diagnosed are, or just in a stage, I always kind of have this caveat of like either newly diagnosed or like at a stage where the disease has gotten worse, because I went almost immediately into remission for 7 years after my diagnosis. So I didn't really learn a lot of things for how to cope with it because my medications worked. But then when I had my first flare up 7 years after my diagnosis, it was like I was newly diagnosed, because it was my first time since my initial diagnosis that I had all these symptoms. So that's why I say, if you're having, if you're just having a difficult time, I should just say that, building a toolbox of tools to manage your symptoms, getting organized, taking care of your mind, and then getting support are like the things I think are super important just from my work in this area. So first is just learning the tools to manage your symptoms. And I like to have everything in a toolbox. Like I literally have, baskets in my house. I have plural because I'm a little bit extra and I have like so many gadgets and stuff that I love. But you might just have one that has your favorite tools. But first I'll just say this: building a toolbox of things that help you with your symptoms is part of this concept called self-management. And there is evidence that shows that it leads to better outcomes, but a lot of patients aren't taught the tools. Now, some of them depends on your medical literacy. If I know we have people here who have a medical background, like some people can do the work of like, looking it up online and finding tips and tricks, but it's also helpful to have someone do a little bit of hand holding sometimes. So self-management is just, I always include this because I just love this, how they worded this. So this is in like a, in the multiplechronic conditions.org. Self-management is the ability of the patient to deal with all that a chronic illness entails, including the symptoms, the treatments, the physical and social consequence, and lifestyle changes. So the thing about a chronic condition is that at the end of the day, like kind of a harsh truth, but like you are the one that's going to be spending the most time thinking about your condition, and you have the most control over your lifestyle changes and the things that you can do on a daily basis to help with your symptoms. So it does help you. It is helpful for you long-term to learn these things. Sorry, I keep like rubbing my eye. I don't know why it's itchy today. So a couple examples. So I separate things into categories. So we have like pain tools, fatigue tools, habits, which is kind of like a lifestyle tool, social, mind and mental health tools, and then like CEO tools. Those are the primary, 6 that I see in rheumatoid arthritis, and that are kind of the classic ones that are used in self-management for conditions that involve pain and fatigue. So we have, for rheumatoid arthritis and, psoriatic arthritis, ankylosing spondylitis, simple things. You can have a pain toolbox where you have your hot packs, your cold packs. You can learn joint protection strategies and also use joint protection gadgets like an electronic can opener or jar opener. One of the rules of thumb for hot and cold is that you kind of want to do the opposite of what your joint is doing. So like if your hand, like mine gets hot and inflamed, you want to do cold when your joint's hot, right? But if it's cold and stiff, if your joint is cold and stiff, then heat works well. So hot shower, hot pack, paraffin bath, stuff like that. And then for fatigue, I'm just giving you kind of like a crash course overview. There's a lot more than just these, but for fatigue, things like pacing yourself, planning ahead, making sure you get adequate rest. And weirdly enough, there's all these paradoxes in rheumatology. Exercise is evidence-based for reducing fatigue. So expending energy, exercising actually leads you to not be as fatigued, even though it seems like it would be the opposite. And that is assuming that you have the just right challenge of exercise. So like the example I used is last summer, I went on a 4-hour hike, and my normal amount of exercise is 20 to 30 minutes of cardio challenge. And so of course I felt absolutely horrible after that hike. It was, but if I worked my way up to it, I wouldn't. That could be a good challenge for me. So just exercise with a caveat that it has to be at the appropriate level for you. And that's something that takes time to figure out. And then in terms of habits, again, exercise kind of falls into that as well. Sleep, and in general, for nutrition, it's a huge can of worms, but the best evidence is for overall an anti-inflammatory eating pattern, Mediterranean-based, and then there's emerging evidence for plant-based diets. And really it's about avoiding, so there's 2 different strategies for nutrition: avoiding the pro-inflammatory and integrating the anti-inflammatory, right? So you have the anti-inflammatory, the foods that actually supposedly reduce inflammation, like blueberries and other whole foods, leafy greens, stuff like that. And then you have avoiding the pro-inflammatory things like fried food, red meat for a lot of people is inflammatory. Animal fats for some people are. Dairy is a classic one for autoimmune. Sorry, I'm going to put eye drops in as we're talking here. Dairy and gluten. And again, my biggest advice or kind of wisdom for food and nutrition is, if your insurance covers it, especially, get help from a registered dietitian, someone with actual expertise in diet and nutrition, because it is very complex. And at the end of the day, you're going to see all these different claims online. Oh, the AIP is the best, the vegan's best, paleo is best. The only way to know the best one for you is to track your own symptoms, your own patterns around food, and track how it affects you. And that's something that a registered dietitian or similar professional could actually help you with. So that's just something to think about. And then another habit would be things that reduce your stress, because stress is also inflammatory, or it drives further inflammation. So I really like mindfulness-based stress reduction, mindfulness exercises, and doing things that help me feel, more centered in my life, because I'm a very all over the place person. And then for social, an example is that we go through actually in the Room to Thrive is developing an elevator speech, or a quick way of describing your illness to friends and family, because it can be a little bit challenging to talk about, so you can have different versions of your elevator speech, but that's just one example. And the other things that I think are really important are, the mind tools. And we're going to talk more about the mental health tools and the CEO tools. That's kind of shorthand in my head for the tools to be the CEO of your care team. Again, kind of with that self-management concept, you're in charge, right? You're in charge of your health. So, figuring out how to track symptoms, how to, communicate with your medical team, how to keep track of your medical records, and just make goals for your health and collaborate with your providers on that and advocate for yourself. Those kind of fall into those higher level skills. So, some examples again, because this is one of the hot topics a lot of people ask me about when they're first diagnosed is, what are some good exercise and nutrition paths for rheumatoid arthritis and similar conditions. So, starting with low impact. I was like, what's the word I'm looking for? Low impact, swimming or cycling are really great because they aren't as hard on the joints. Now, that said, you do actually want to get some weight bearing on your joints. It's not good to avoid movement. So walking can be great too. And you do want to, I think of exercise into 3 categories: stretching, strengthening, and cardio. If you have rheumatoid arthritis, you are at higher risk of cardiovascular disease. So if you're doing something like yoga, that's really good for stretching and potentially strengthening depending on the moves. but depending on how you're doing it, it may not be enough for cardio. You want, and I can send it to you all if you're interested, but there's a rule of thumb from the American Heart Association that you want to get your heart rate at X amount. Like I know for me, it's like kind of like between 130 and 160. I need to get my heart rate up there, and that's actually challenging my heart. So, you can also do things like I mentioned nutrition earlier. So, my biggest, kind of soapbox for nutrition is just try to avoid this all or nothing pattern that some people get unfortunately sucked into, where it's like, oh, I'm a failure if I don't eat perfect or I don't eat clean all the time or something. There is actually like an eating disorder called orthorexia, which is like an unhealthy obsession with healthy eating. And so I've seen a lot of people with autoimmune diseases fall into that because it's something like one of the few things you can control is what you eat to some extent. So just be careful if there's anything that's all or nothing, unless you work well that way. And like, if it's working for you, you ain't broke, don't fix it. But getting a toolbox, I mentioned, of pain relief items, also protecting your joints by using an ergonomic mouse or like a tripod for your cell phone. I don't like the pop sockets, but a lot of people with rheumatoid arthritis do. I prefer to put my phone in a tripod, but when you're holding your phone for long periods of time, it puts pressure on your knuckles, which are the ones that hurt usually the most with rheumatoid arthritis. And then starting a mindfulness practice. So these are all tools for your toolbox. And some of the gadgets that might help in the kitchen would be things like, a jar opening aid, and things like, again, integrating exercise into your daily routines. And for fatigue, as mentioned earlier, pacing yourself, delegating, that's like my favorite one, but I know it's not always realistic, but making someone else do part of it, or even things like, grocery delivery instead of going to the grocery store yourself. Again, depending on where you live, that may or may not be accessible. So if there's any questions on that, I mean, no one has questions so far, so I'm just going to keep going. But, when people are overwhelmed, a lot of times it is something where getting organized can actually go a long way. So if we have, if you have one place where you keep everything, like one master record for your health records or one master list, that's what I find helpful. So, I love checklists. There's a whole book called like the Checklist Manifesto. I don't know if anyone's ever read that, but it's really good. And it's by a doctor actually. And, you're expected to learn a lot of information. So a checklist can help you keep things in one place. So I made this master checklist to help people, list everything that they might need to do to manage their condition in one easy place. And so that is something that I'm going to give a copy to everyone if you don't already have it. Some of you already have it because you signed up to get it. But there we go. So you can get it at this bit.ly/RA checklist, or you can or that's just going to make you enter your email address. So I will just send it to you all. But I find it helpful. Honestly, even if you don't use a checklist, just knowing it exists, it's like, okay, I have a checklist. This is good. This is a resource for me. And the last thing in this section for organizing is, it's really a shame that the interdisciplinary team isn't utilized more in rheumatology. Sorry, that's a little soapbox of mine, but there are so many people that can help you. Like there are social workers, counselors. I'm an occupational therapist, so I'm obviously a little biased. I think we're great. And most of the patients I talk to who've gone to occupational therapy are like, this is so great. Why didn't I go to this earlier? Physical therapy, a different discipline. Just we're not, sometimes people are like OT-PT, like they're the same. They are different. Primary care physician or your nurse practitioner, they're part of your team. Registered dietitian can be part of your team. Pharmacist. Did you know you can just call your pharmacist and ask questions? Like, I didn't know you could do that for the pharmacies like Walgreens. Like, I thought that was more something you could just do for like a hospital pharmacy. No, they're supposed to be there to answer your questions. Psychiatrists or psychologists, if you're struggling with, anxiety and depression, which is not unusual with these conditions, they can really, really help. So that's number 2 is getting organized. And I guess I kind of snuck in there, organizing a team around you as well. And then this is number 3 is like my most favorite one to talk about. So, but I want to make sure I leave room for questions, and I respect your time. So I'm not going to go too far over, but I'm going to talk a little bit about mental tools, because no matter how, what your physical state is, these diseases do take a mental toll on most people at some point. It's a lot to cope with. So mindfulness is kind of it's not new, but in the US, it's kind of become the new buzzword. And there are a lot of, oh, hi. There's a lot of times that mindfulness is kind of packaged as like, oh, just do mindfulness and you'll feel better. But I find that to be the most helpful to think of mindfulness as simply keeping your attention in the present moment without judging it as happy or sad, good or bad. So it's really different than trying to feel calm, right? It's not about clearing your mind. It's not about trying to feel peaceful. It's attending to the present moment. And a lot of times that does involve, if you're doing like a mindfulness meditation, you might focus on your breath, but it doesn't mean that you're trying to control your thoughts or make yourself just become this peaceful person. You can literally just be like, I'm noticing I'm having these thoughts. Like I'm noticing I'm having thoughts about my future. And that's just the noticing and paying attention to your thoughts in the present moment is mindfulness itself. So you learn how to observe what's going on without trying to change it, which I never realized how often I try to change the present until I started just practicing observing it without changing it. And I was like, whoa, I am a control freak. Like, so I don't know if anyone else has tried any sort of mindfulness practice, let me know in the comments. I'm just curious, or in the chat. I keep saying comments. But so why do I like mindfulness if I'm overwhelmed? Is because a lot of times, I was just talking to someone this morning on an Instagram Live about this, that our overwhelm, our sense of overwhelm is kind of made worse because we're thinking so much about what could happen in the future, not about what's happening right now. So what does this mean? What if this medicine doesn't work? What if my insurance doesn't cover it? What if this? What if that? And it's like, you could literally spend your whole life wondering or worrying about the future. I mean, you truly could. And I know I could, because I'm really good at thinking about all the possibilities. I actually thought of a pandemic. I'm not kidding. Like this was on my list when we were thinking about having another child, like, and we have one and we stayed with one. And this, like, I swear I felt vindicated. I mean, obviously very upset with the pandemic, but I was like, this is why, because I was like, the only way I could have another child is if I could know for sure that we could get help, and that there would be nothing that would come in the way of that. And I'm like, the pandemic is the exact situation, right? No one can see each other. You're stuck at home. Like, anyway, sorry. Whew, that's my story. But yeah, what's happening right now is very, it's very helpful for me. It's been helpful. And it's for a lot of people with chronic illnesses. Acceptance and commitment therapy is the kind of approach. I don't know if it's even considered a technique. It's mindfulness plus action. So you start with mindfulness. You start saying, I'm going to connect to the present moment and accept whatever those thoughts are and feelings. It's kind of like, because you're not trying to change them, right? You're just noticing them. That's like a form of acceptance. And then you connect with your values and take effective action. And so when you allow your feelings to be exactly as they are, this is from Russ Harris, and then you ask, what can I do right now that's truly meaningful or important, is different than saying, how do I feel better, right? And I know some people, and if you're in that stage where all you want is to feel better, I totally get it. But it's a little bit of like the harsh truth in this approach that ends up being helpful to me is that, like, at some point we can't necessarily make something better. Like, we might say, okay, I have tried all the tools I have at my disposal to make my hand pain better right now, and I can't do anything else. Like, but what can I do? You say, okay, well, yeah, you connect to what's important in your life and you actually take action towards that, instead of kind of being on this endless quest to relieve your symptoms, which again may or may not actually end up being fruitful in the end. So if this is unintuitive to you, it's okay, because it was very unintuitive to me when I learned it. But I'm like, why would you want to accept bad thoughts like sadness or anger or frustration? But in ACT, your interest in the thought is not whether it's true or false, but whether it's helpful. So if you pay attention to this thought, it will help you create the life you want. If not, you just say, oh, okay, thank you, brain, for telling me that story, but I'm not really going to pay attention to that right now. So your emotions and your thoughts don't become problems anymore. They're just little internal stimuli that you can choose to pay attention to or not. So this takes time. This is a big concept. I'm trying to put the seed in your mind as soon as possible, because it's something I wish I had, learned earlier. So, when you have a chronic illness, you always have two choices for kind of where to put your energy. And this kind of is a different way of saying what I was just saying. You can try to make the problem go away. So if you have pain and fatigue, there's a lot of tools. You need to have the tools. So it's not one or the other. You need both of these. Okay. You need the tools to reduce your pain and fatigue, and you also, it's helpful to try to I actually don't resonate with the idea of curing or healing the condition, because it's not real. I mean, I've had this for 19 years, right? So I've tried everything. So, but if that's where I'm very open to wherever you are, your journey, but you can try to make it go away, basically, make the problem go away. But there's also always this possibility to work around whatever it is and function despite it, saying, okay, well, this really, really sucks, but can I work around it? Can I delegate for fatigue? Can I reduce my workload somehow? Can I, focus on what I still can do? If I can't run, can I use an exercise bike? And this isn't to say to use this technique to shame yourself for feeling sad about the things you've lost. I used to be a runner, and right now my body can't really handle running. And that is sad to me, because I'm one of those freaky people that liked running. Okay. So I know a lot of people don't. They're like, oh, I would want an excuse not to run. But I can say, okay, well, I can ride a bike. And I am grateful for that. I'm truly grateful that I can ride a bike, and that's something my body can do. There's people who have rheumatoid arthritis who can't do that. But I also don't want to say, it's also valid to feel sad that I can't run. Because when I see someone running, I'm kind of like, oh, I wish I could do that. And so you just kind of allow yourself to have both of those things, is what helps me. So, okay. So self-compassion is another really helpful technique. So it's so simple, so simple. It's literally giving yourself the kindness you would give to a good friend. But how often do we not do that? How often are we so hard on ourselves? I have so many negative thoughts every day. People are like, oh, you seem so positive. I'm like, I have a total running commentary in my life. That's oh, wow, Valentine, that's cool. You like to run because God used it to help me clear your mind and focus. It is weird how running helps your mind. It definitely, I've had that experience too. It kind of clears things up. And so, we tend to have we tend to be harder on ourselves than we are on the people in our lives. Right. So if we treat ourselves the way, what the things we say to ourselves, we would the negative things I say to myself, I would never say to a friend, you're so stupid. Why'd you forget that? You're always making mistakes or something. So I have a very perfectionistic streak. So, you learn, you say, okay, the three elements of self-compassion are self-kindness, common humanity, and mindfulness. So in self-kindness, you just say, instead of judging yourself for not doing a good job dealing with it, say, okay, this is difficult. How can I comfort and care for myself in this moment? Wow, that seems a lot nicer than being like, you suck, common humanity versus isolation, just reminding yourself that everyone suffers. Every person in the world has suffered at some point. No one has a perfect life, and no one is free from any sort of pain or suffering. There are different degrees for sure, but having challenges is part of life that everyone faces. And so you can kind of imagine yourself as part of a big community of people who are all struggling, instead of I'm on my own, versus isolation, right? No one understands. And then mindfulness versus over-identification is, again, instead of over-identifying with the thoughts and emotions that arise, just allowing them and being present to them. So, that's those two techniques, ACT and mindfulness, ACT and self-compassion. The other one is cognitive behavior therapy, which is very commonly, used in psychology and counseling. And the thing that I find the most helpful about is teaching you to be a detective about your thoughts. Are your thoughts true, or are they distorted? And if they are distorted, you learn how to reframe them. So, my most favorite exercise is catching ants, automatic negative thoughts, and saying, oh, is there a different story I could tell myself about this event? I forgot my medicine. Oops. I'm a human being. Everyone forgets things, versus I forgot my medicine. I'm so stupid. La, la, la. So, Yeah. Oh, Valentine, self-compassion is hard. Yes, it is hard. I forgot the time of my daughter's baby shower. It broke your heart. Yeah, yeah. I'm sorry. It's so hard. It is really hard, but it is something that can get easier with practice. It really can. And especially because it usually feels good. So your brain is like, I want to do more of this, right? It's reinforcing. And the last little thing in this section is just gratitude. A lot of people find it helpful to do a gratitude journal. And again, I'm not saying that to say you should be grateful, like in a toxic positivity sense of like, just think about what you have. Like it could be worse, but just to take a moment to say, okay, there's a lot of bad things going on in my life. There's a lot of suffering and a lot of things I'm really upset about. But can I also take a moment just to connect with what's going well? What is something I'm grateful for? What do I still have is very powerful, and like I love this picture of my dog and my family. But an example from my life, I actually guess I already mentioned it, that we always wanted to have kids, and like we didn't even consider, quote unquote, having an only child or only stopping at one. We just always thought we'd have multiple kids. And after having him, my condition got a lot worse, and then I had like 3 other acute health issues come up that took years to get through. And then I was like 38, 39, and we're like basically came down to like, I only could imagine getting pregnant again under the best case scenario. I know we could have done it under the best, but you can't guarantee the best scenario, right? You can't guarantee that it would be an easy pregnancy, easy baby, easy everything. So, we had to make this super difficult choice. And I do still grieve that when I see people, and my son's best 2 friends are his cousins. And he's like, why don't I have a brother? And but that's life. Like I feel for him, but also, wow, I still was able to have a child. So many people struggle with fertility. And I'm so grateful that I had the experience to be pregnant and have him, because that's something I always dreamed of having. And it's just, and now I have my puppy with my second child. And I always said I'm not going to be one of those people who refers to their dog as their child. I've totally gone back on that. But and so can we have both? Can we have a little moment? I really agree putting the baby clothes away. I still like, I'm looking at that and I'm like, oh man. I mean, it was a weird situation because I had such a tough time postpartum that part of me is like, oh God, I never want to do that again. But the other part of me was like, oh, well, it's worth it. Cause obviously, once you get out of that baby stage, it was easier. But anyway, short story long, as I like to say. But the last thing is getting support. Again, I kind of alluded to this with forming your team around you, finding support. There's different ways, right? You can get in-person support or online. You can get group support versus individual, diagnostic specific support, or just general support. You can have support groups that are like facilitated by patients or other lay people who don't have any medical training or professionals, and I don't want to be a snob and be like, because I'm a lot of times health professionals are like, you should only go to groups and have things when someone's a trained health professional. But there's a saying in rheumatology that patients become experts. Patients are the experts in their own care. And you are the expert in your own care. You really are. And you develop a lot of knowledge and expertise just with dealing with what you're dealing with, and especially over time. So the point being, how do you find a support group or therapist? There are, and I am happy to point people to more. I mean, I'm obviously going to talk about my own, but I'm also, there's Arthritis Foundation in the United States has Live Yes Connect groups that are like grouped by region, and they're once a month, and they kind of include like a blend of like guest speakers. And I go to my local Seattle one. It's great, but I made mine to be a little bit more intensive, but that's a great option too, especially if you want to connect with people locally, because that way you can kind of have someone in your region. You can actually make an arthritis friend that's not only virtual. I have so many virtual arthritis friends now, which is awesome. But and then there's also nonprofits and hospitals that offer groups, some in person. I know if you're lucky, if you're in New York, I don't know if anyone's in New York, but Hospital for Special Surgery has a really great group there. It's confusing because it's called Hospital for Special Surgery, but they have more than just special surgery. So I was like, what even is special surgery? And so there's a lot. Take a deep breath. There's a lot to learn. Feelings are for feeling, as Glennon Doyle Melton says. Okay. We can feel our feelings. So this is the recap. You learn the tools to manage your day-to-day, you get organized, take care of your mind, and get support. That's like the crash course version of how to like try to thrive with this. And so, you might wonder, well, wait a minute, why aren't people getting more support? And there's studies that show, like patients with inflammatory arthritis, rheumatoid, psoriatic, ankylosing, feel like they don't get enough information. So if you feel like you haven't gotten enough information, you are not alone. That is the norm. So, they want you, I'm guessing, are similar, want to be able to, be recognized as more than your disease, to re-engage in previously abandoned activities. And so that's part of why I'm developing what I have, with Room to Thrive. So, it is harder on your own. Some people can do it though. Some people are like, that was funny. The other day, someone was like, there's two kinds of people. There's like the direction askers who just want to ask someone, but then there's also like the map reader people who are like, I'm going to figure it out. So some people love figuring things out on their own. So this is a little bit too simplistic, but in my experience, it has been, and I probably have a self-selected population here, but that it is easier when you have support. And I'm like a super extrovert. Like I did the MBTI, like Myers-Briggs extrovert, and they're like, wow, you are the most extroverted. Like you are extroverted. So, but yeah, and it does cost time and energy, and it can be very confusing to figure out on your own. So that's why I made my courses. Oh my gosh, hello, it's too much of me here. But, my job is in my mind that I created this job myself. I just out of thin air, I just like, someone has to do this. I finally was like, someone needs to do this. And I was like, okay, I'm someone, I'm going to do this. To give you like an orientation to this job of being a rheumatoid arthritis and inflammatory arthritis patient and help you feel less alone. And I have a self-paced course, which is the Rheumatoid Arthritis Roadmap. And then I have the group, which is like a 6-month currently program. And I'm going to shorten it in the future just because it is a little bit of an intimidating level of time commitment. So I'm going to try to get it into like more of a 12 to 16 week format. But just for now, it's currently a 6-month program. Where the reason I liked 6 months is because it lined up perfectly with Thrive. So each month has a different, I'm like, seriously, this is how my brain works. So, but I'm like, okay, well, we could just do like group these two together, group those two together, maybe. And so we talk about all of these things. Each month has a different focus. And then we also have a support section at the end of each meeting. So we have a bit of each. It's like learning. I keep trying to think if there's like a better way to talk about it. It's like a learning and support group or educational support group. So it's 3 minimum live meetings a month, and then the support section. And then there's like a additional online community. It's on Facebook, but it is in a private group. But I know that Facebook is icky to some people, which I totally get. So it is, so actually I only open the registration a couple times a year. So it is timely. It is open right now. So I'll put the link in the comments, but if you want to learn from other people, like I truly, like, I don't know if any of you have read Tina Fey's memoir, but it's so funny. On the back, she puts negative reviews and positive reviews. And it's like the first negative review is from her dad. And it's like, too long or something, or like, it's so hilarious. So I was like, I literally don't, like, it's important to me, like as a health professional, to be like objective and not just be like cherry picking, like only the best reviews. Like so far it's been really positive, but again, I think people who have only been interested in this who actually would want it and be happy with it. It's a self-selecting population, but the things people have said are that they don't want to spin their wheels researching and overthinking. They like that I'm sharing the tips and tools, and they like the close community. And then, people, Erin, she's been on the podcast, so she's like open about everything, but, she already knew about how to care for her disease and care for herself, but it's the community that she really liked. So, and that's my goal, is for people to feel more validated and empowered at the end. That really is the goal. So these are the latest 2 podcasts. I had people who've taken the program, the Room to Thrive program, who want to share about it, share about that if you want to listen to those. So this is like the biggest brain dump in the world, but I want to make sure I have time. I have extra time too. I don't know how many of you have extra time, but if there's more questions, but I will send a recording link just so you know, and this is my email and website, but I'll send these all to you at the end. But I want to stop sharing now so that I can make sure to get to questions. It'll be funny if like no one has any questions, because then I'll be like, oh, I just rushed that end part. But questions about what I talked about or just what you're dealing with, I'm kind of an open book. So if you have questions about the programs, Anything?
And
Yeah. Hi, Rebecca.
hey, this sounds fantastic.
Oh, cool.
Is there, and maybe I missed it on your website, but is there like for the scheduled Zoom meetings, like a
Yes.
schedule or any?
Yes. Okay. Yeah. So this is how it works. So I've gone back and forth on this for a long time, but like the way it currently works is that I set the default schedule for Thursdays and Saturdays. So like Thursdays, 7:15 p.m. Eastern. So you're in my time zone. So 4:15 Pacific Thursdays, and then Saturdays 9 a.m. That's for April. And then for May through September, I send a doodle poll to the people currently enrolled and then try to find the best times that work for everyone. Like historically, the Thursday afternoon, Saturday morning is what has worked the best consistently. But sometimes we have more people on the East Coast, or sometimes we have more people in Europe when we kind of bump up the times actually earlier in the day. But those are I can say now, because I've actually gotten some of the doodle responses, it's almost positive for sure going to be 9 a.m. every other Saturday Pacific time. But it's just whether or not what's that other time going to be is the kind of question mark.
And if we weren't able to make like Saturday mornings work,
Mm-hmm.
or the recording?
Yes, everything is recorded, and you can submit questions ahead of time, and you can speak off the record, by the way, because I know that the recording piece like scares people sometimes, because they, if they want to talk about something like, their intimacy with their partner or something like that they just don't want the idea that maybe someone could get their hands on that, or just anything private that you don't want to share. I can stop the recording and then people can speak off the record. So I know that actually I didn't do it. I'll just be one critical thing about this, or that someone said, is when I very, very, very first did it, the very first time. Did I say very first? No. Someone was like, I didn't make it clear that it would be recorded, and she just really didn't like that. She actually she just didn't want that. So she left it pretty much. And you can have, if you join and you decide it's not right for you, like this is just me. Like I'm not trying to swindle anyone. So, if it's not a good fit, or like there's people who've started it and then like a horrible life event has happened and they need to put the pause on or just get a refund and come back later if they can, that's fine. I'm very much open to whatever. But yeah, that person, I just didn't make it clear that it would be recorded. And she just really didn't want it to be recorded. So yeah. Yes, but the schedule, I really do try to make it so that the most people can attend. But then the problem is then it becomes awkward, because then you're like, well, I don't really know the schedule. So my goal would be right now, it's not popular enough to where I could have my goal would be, if we get more people interested, to be we have you could sign up for the Saturday group or sign up for the Friday morning group or the third, that way you would know. And actually I like that better, to kind of know ahead of time. But this is the best way to get everyone the best chance of being able to attend. Oh, and Valentine. Yeah. You heard you're going to jump on to view the link. Yeah. Grief shared is, oh, I like that one. When you went to a grief course that said grief shared is grief diminished. Yeah. Oh, I have not heard that, or if I had, I forgot it. So thank you for reminding me, because that's beautiful. That's beautiful. I love that. Yeah. Rebecca, any other questions about the logistics, or
I don't think so. We sent quite a few DMs earlier today.
Oh, okay. Yes.
Yeah. So I'm on board.
No, it's I sometimes don't put the Instagram handle to the name.
Oh, how could you?
Yeah, no.
Yeah. So thank you. No, I'm excited, even though I'm not rheumatoid arthritis. Everything you said is
yeah,
meets all of my deficits of struggling. And so just really, yeah.
Oh, yeah. And it feels meant to be, because not only did a bunch of people, well, okay, I don't want to out anything that you've said without you saying it, but I just saw an ad for a free course on one of the conditions that you had mentioned that I'm going to be attending in May. So I'm like, oh, perfect. You know, so it's like learning more about, because a lot of people with rheumatoid arthritis and or similar conditions, we have multiple comorbidities. Like I would bet my life that I have POTS. I just haven't been tested for it, but I have all the symptoms of it. Like I get dizzy and lightheaded like every single time I stand up. Like, and I know I'm like, okay, I know that's a symptom. But you know, there's other things that, you know, a lot of us have like hypermobility or connective tissue issues. So, you know, have dysautonomia in general, whether that's EDS, you know, a POTS, gastroparesis, other things. So yeah, having expertise in multiple things is helpful, but it is definitely designed for, you know, the main focus of like the tools for pain and stuff are for pain that's caused by rheumatic. But now I put Becca to Rebecca. Now I get it. Okay.
Yeah.
Yeah. And, oh yeah. Imelda. Yeah. And Spanish, I want to make sure I acknowledge, yes. I think that would be amazing to have more resources in Spanish. There's two people I will refer you to that do give a lot of great resources. I'm sure there's many more than two, but Cristina Montoya, she is the arthritis pain dietitian. It's so sad. She used to have like 3,000 followers, but then someone hacked into her account. And so she just had to redo it. But Cristina Montoya, she is native Spanish speaker from Colombia. And she has rheumatoid arthritis. She's my RA twin because she's also had it for 19 years. and we both have one child. We both have a boy. It's really weird. And then the other one is Maria. Oh my God, brain fog. Maria. What is her last name? She has a pain. Oh, 𝗪𝗪𝗃𝗲𝗍 pain, Spanish language pain magazine. So, oh yeah, thank you, Megan. Oh, bye, Megan. Sorry. Yeah, you gotta get kids to bed. Yeah, it's late. Yeah, Imelda, those two accounts, if you're on Instagram, are very helpful. And I'm glad it was helpful, Dawn. Thank you. Yeah, if you need to go, don't feel bad. I'll stay for, I have 15 more minutes if people have more questions, but we can also end if everyone's good. But yeah, 𝗪𝗪𝗃𝗲𝗍, it's Maria Gonzalez, I think. Okay, thank you. Let's see, there is Maria. Yeah, Maria Gonzalez. She's the one that does the 𝗪𝗪𝗃𝗲𝗍. Ouch. I don't know if it's ouch, pronounced ouch or ouch. But any other questions? Cassandra, Imelda, I think people are dropping off. But if anyone's been waiting, they always say in therapy, you know, sometimes people wait till the very last minute. Okay, good. You're good. Okay, awesome. So I'll send you the link. I'll send you all the recording link and then some of the links from the chat here. But thank you all for your time. And I look forward to seeing some of you soon in the group. Okay, bye-bye for now. Bye.